Welcome doctors, most of us are confident about HIPAA. Locked filing cabinets, encrypted phone calls, secure EMRs, we've got those bases covered. But here's the catch, HIPAA alone isn't enough. Because every payer has its own set of rules, and if we miss even one of those requirements, it can cost us not just in denied claims, but sometimes in compliance violations too. I recently heard from a physician who said, "We followed HIPAA, but one missed payer rule led to a denied claim and a patient complaint." That's the reality, so why do payer-specific rules matter so much? Insurers create them to manage costs and enforce medical necessity. But for clinics like ours, it turns into a maze. Different documentation formats for each payer. Unique timelines for claim submissions. Changing referral and pre-authorization requirements. Coding rules that shift depending on who the insurer is. And if our staff misses even a single step, the result is delayed payments, denied claims, and sometimes frustrated patients who don't understand why their care is delayed. Here's the problem. Most clinics think if they meet HIPAA standards, they're covered. But HIPAA only protects patient data. It doesn't protect us from payer audits, revenue loss, or those compliance traps hidden in billing rules. So when payer rules aren't followed, we get claim denials, revenue leakage, audit red flags, and unhappy patients. One administrator told me, "We spend more time fixing denied claims than submitting new ones." And if you've ever felt like your staff is drowning in portals, paperwork, and reworked claims, you know exactly what the truth is. HIPAA compliance alone is not enough anymore. Yes, it builds patient trust and keeps data safe. But payers demand that we follow their workflows, too. That's where smart systems make the difference. Clinics that thrive are the ones that combine security with accuracy. That means HIPAA-compliant documentation storage, rule-based claim checks before submission, audit trails that show insurers you're compliant, and ongoing staff training that covers both HIPAA law and payer requirements. And let's be honest, no matter how good your team is, humans make mistakes. That's why tools like AI-powered compliance checks or outsourced billing teams trained in payer rules are changing the game. One clinic told me that after outsourcing, their denial rate dropped by 40% simply because every payer rule was followed. So here's the takeaway, doctors, HIPAA keeps us compliant with the law. But if we want to stay profitable and keep patients happy, we have to play by the payer's rules too. The clinics that succeed are the ones that stop seeing compliance as one size fits all, and start building systems that cover both sides of the equation. Thanks for watching.